Hi, I'm Esteban. I'm really excited for a new course we've developed at the International Academy of Orthopedic Medicine. We have combined our Lumbar 1 course and our Lumbar 2 course. A few years ago, we renamed them as acute lumbar and recurrent and chronic lumbar pain. And every time I taught those courses, I felt a little bad because I'm like, okay, you know how to treat acute pain, come back to see me another time to learn how to treat more recurrent and chronic pain. And so we combined them into one course. We've spent the last year hashing it out how we can make the course more clinically relevant and get all the information into the two courses into one course, but not make it lecture heavy during the live course. So we're recording a lot of these lectures online for you, so when we're together at the course, you can spend more time doing your manual therapy skills, perfecting your exam skills, and perfecting your treatment skills. So we combine that Lumbar 1 and Lumbar 2, and we get to spin the whole story of the lumbar spine now, taking you from the injury phase to the instability phase. That's a majority of what we see in the clinic is patients have this recurrent low back pain that comes and goes, or no one's gotten them better, and they've tried all the tricks they worked the first time they had low back pain, but they don't work anymore. And so then the instability phase, you gotta look for a lot more dysfunctions, and you can not rely on time anymore for them to get better. Their first time low back pain, you could sometimes do the wrong treatment, and eventually they're gonna get better, sometimes not. But definitely in the recurrent phase, if you don't put the right recipe of treatment together, they're likely not going to get better. So these are my favorite patients, and that's the instability phase that you get all in one course now. And then you got your older patients. They're in the adapted phase. The segment is now degenerated. It's got more osteophytes and less room for nerves, and so you get all that into one course that we're packaged together for you. So our goals for the course is to teach you the most common pain generators that you're likely to see in the clinic, and make sure you understand how to diagnose those and how you treat them in the clinic. I want you to leave each course making sure you're confident, you know how to diagnose, you know how to manage with several different techniques, and have time to get good at techniques. I want you to have time to get good manual skills. It takes time to develop good manual therapy hands, and it starts at the course, so we're putting more time into the labs and more time working on each other. And I'm going to really encourage you to switch partners. If you're with a skinny partner, switch to a super muscular partner, switch to a heavy set partner, because patients are all different sizes and you've got to get good at doing that. And I'm going to really encourage you to make every technique feel good. I want to ultimately help you become a more complete clinician. I want you to have many tools in your toolbox so you know how to treat the basic low back pain all the way into your really complex patient that no one else has gotten better, and they've seen 10 different therapists and doctors and chiropractors. You're going to have the skill set to help navigate that person to feeling better and becoming more active. I want the courses to be fun, so it's not going to be the instructor lecturing as much during live courses. The lecture material is going to be more clinically relevant, and the online material is going to be all the background information that you need so you're comfortable and you understand what we're teaching at the live courses. We've updated the lumbar exam. It used to be 2 separate exams, a basic clinical exam with some extra tests, and a separate local exam. We cut out many tests. We sat together and we said, which test do we really use the most? What's the research supporting? And what fits the story of what you need to know? So we got rid of some tests. So now it's just one exam form. The front page is your basic clinical exam. The back page is some extra tests, and your sacroiliac exam, and your local exam when you look for mobility of the facet joints. Some course highlights are you're going to learn how to diagnose an internal disc disruption, a protrusion, a prolapse, an extrusion. You'll have clear slides that will identify each one. what the pain pattern's like, what are the positive tests, what are the negative tests, and most important, how do you treat them differently, and how is the prognosis differently. I want to start adding in features of prognosis into the courses so you understand this patient's going to be better in about 4 visits, this one needs 8 visits, and this one's going to need 6 months to a year, so I'm going to see them less often. And you want to set that up day one, getting realistic expectations when you work with your patient on their goals, your goals, and about how soon it's going to take for them to start feeling better. You're going to learn how to diagnose and treat joint disorders of the sacroiliac joint and the facet joints. And we're going to give you many strategies on how to educate your patients. You're going to get some handouts along with the course that I've been making over the last several years. So you just hand them out. Here's what facet synovitis looks like. Here's some things you can do at home. Here's what your partner at home can do for you to help you get better quicker. So this study says people with low back pain expressed a strong desire for a diagnosis. I know in physical therapy these days, some people are saying don't diagnose. And for the last 30 years, I am saying we want to try to identify, when we can, we want to identify the structure that's causing the patient's pain. Because once you do that, you can have a direct technique and know the most effective technique that's going to help that pain. But also, it's not just the tissue's issue. We want to find out the dysfunctions, and I'm going to talk a little bit about what dysfunctions we're going to start looking at. And so this study said patients want a diagnosis. They want a prognosis. They want to know how long it's going to take to get better, and they want treatment options and self-management strategies. We do this at every course. We're going to do case studies. We're making more case studies in the last 2 years than we've ever had. We're starting to record case studies on a voice over PowerPoint, so you can start watching those after the course. And then what I love to do at live courses is if anyone has pain in the area we're teaching on, bring up people for live courses. It's one of the best ways to learn. And when we are doing our exams, I want you to start separating your brains and think of a pain generator and dysfunctions. They are both important. Remember, the pain generator we're going to have direct treatments for, and the dysfunctions we're going to have indirect treatments. And I've taken many slides, and I hired models. I took pictures. I made moving GIFs, as you see on the screen, so the techniques are going to be more clear for you. We also are starting to build some handouts describing step-by-step of each of the main techniques. And I think we're going to sell those for a small amount because they take a lot of time and money to set up a photo shoot and do graphic design. So it's going to be like a little package of all the techniques per course for a nominal fee, like $29 or something. So that's in the works, but people have been asking me for years, hey, can you take better pictures, Esteban? Can you make sure it's more clear? Can you make sure we have some handouts so we can figure out the technique 2 months after the course, a year after the course? So we have those in store for you. We have patient profiles. And so we are going to clearly identify what sacroiliac joint arthropathy looks like, what facet joint arthropathy looks like, what a protrusion looks like, and it's going to be all crystal clear for you on a slide, and I'm going to give those to you in a Dropbox. So you have those. And here's our little moving GIF. So I take anatomy slides, I make those move while we try to move and put my photos together. So you can see not only what it looks like on the person, but what it looks like with the anatomical illustration. And then here's the handouts. We have exercise programs that we've created in my clinic. We have 10 stages that we take our lumbar patients through. We just give you the overview of that program. We have also with that program as a separate thing than the course, handouts on every single of the 50+ exercises that you purchase separately that you give to your patients, use for marketing. One of the things I do is I tell my patients, if you stick with me for this entire program and don't just stop coming, I will email you the whole program so you have everything. You can watch it on your phone, you can use it on your computer, and it's going to have, I put my clinic logo on it, so it's out there marketing. I use it for marketing to doctors so they know that PT is not going to get the job done in 2 visits. I'm going to need more time because I'm teaching people to self-manage their, and then techniques. I'm going to give you handouts on axial separation. So I tell my patients, hey, make sure your spouse can come in and I'll teach them how to do this technique so you don't have to see me as often, or you might not need to see me as long. Or in real life right now, my schedule's booked out for 3-4 weeks. So do this until I can get you in on the schedule. So those handouts are going to be part of the course now. We're going to put all the old lectures online, and right now in another room we're recording new supplemental videos for you. So that's going to make sure our time together in the course is more spent on our manual techniques and discussions on case studies and making sure we have time to discuss exercise and fit 2 courses into one. So I'm super excited about the lumbar course, and I hope to see you there.